Huaer Technology Company Limited, dedicated to research and manufacture and sales and service of medical and dental equipment, is one of the most professional high-tech industry in this field. We built a production center in Shanghai and have cooperated and communicated with more than 100 famous photoelectricity research centers from many countries in the world. Huaer teeth whitening system have been sold abroad such as East Europe, North Europe, North America and Southeast Asia, and is well liked by home and overseas clients. The teeth whitening procedure is very short and provides much better whitening results than any other similar product. The safety, reliability, and result of Huaer teeth whitening system have made it become one of the most popular whitening products in the world and be well recommended by the dentist. The teeth whitening system uses high-intensity blue light at a wavelength of 480 to 520 nanometers. The light is filtered through over 30 layers of the coated optic glass to remove infrared and ultraviolet light. During the whitening treatment, there is no necessity to apply the suntan oil. It's totally safe and not harmful for the skin. No hypersusceptibility or burn. The beam of the cold light illuminates the surface of the teeth that have been coated by whitening filter. Within a short treatment cycle, the whitening filter through the dentinal tubule will aquareduct with the stance to whiten not only teeth surface but stain in deep of the teeth. Quickly return 16 to 20 teeth to the natural white color, removing years of stains in just one treatment. Such teeth whitening technology can effect for teeth discoloration by smoking non-coffee or other colored foods. It also whitens teeth colored by medicines such as tetracycline or speckled by fluoride or aged yellow teeth. The special optics design of Huaer teeth whitening system provides more comfortable whitening treatment with every patient. The complete treatment is only 30 minutes. On average, Huaer teeth whitening system can promote the teeth color by 8 whiter shades, with a max improvement of 14 whiter shades. So-called light teeth whitening technology is widely recognized as the most effective and safe whitening method. The dentist using Huaer teeth whitening system must first realize the needs of the patient and create the teeth whitening plan. Then tell the patient. The dentist using the whitening system should use the 16 Vital Dental Shade Guide or other common dental shade guide to realize the tooth shade prior treatment and show the patient the current shade or shade of teeth. Remember the shade showing in production manual. We recommend taking a picture for the patient's teeth prior the whitening treatment. Ask the patient to wear the protection wiring and glasses included in the system. Add water to the polishing sand. Use the low-speed dental handpiece to polish the surface of the teeth. Then let the patient rinse mouth. Apply the lid protection oil to keep the lid comfortable during the treatment. Insert the cheek retractor, making sure the tongue guard is deposited downwards. Ask the patient to gently bite down the cheek retractor to keep them at the right place. Inform the patient during the process they may swallow any saliva they may have. Place the face protection towel surrounding the cheek retractor. Insert the cotton rolls into the cheek margin on top and bottom, left and right. Dry the gum and the surface of the teeth. Apply the rubber dam to gingival area. Rubber dam should cover 1 to 2 mm of the gum tissue. Use the curing light unit to cure the rubber dam for about 3 seconds to make sure to solidify it. Do not hold the curing light to the same place. Apply the protection lip oil to the inner lip and the area of the soft tissue, which is not covered by the rubber dam. Dry the surface of the teeth. Mix the whitening liquid and powder to paste. Apply the teeth whitening formula evenly to the visible front of the teeth. For most patients, they normally enjoy 16 teeth up and down and more teeth. Apply 2 to 3 mm layer of the whitening formula on the surface of the teeth. Adjust the angle of the teeth whitening accelerator light. It should be 90 angle to the teeth surface. The whitening accelerator should be close possible to the cheek retractor. Press the on button to start the first 5 to 8 minutes cycle. The dentist can adjust the treatment time based on the patient's discoloration and adjust the time of cycle accordingly by the time button. Simply press the time button to make the adjustment of the treatment cycle time. Each cycle can be adjusted from 8 to 12 minutes based on the patient's teeth discoloration. The dentist may provide the patient with all music or video for entertainment and enjoying the treatment. Tell the patient to relax and enjoy the whitening procedure. After treatment cycle, the whitening system will automatically turn off. Use the cotton towel to wipe off the whitening formula on the teeth surface or use suction pipe to suction it. Do not rinse with water. Please kindly note, do not touch the rubber dam during this process. Repeat the process twice. Each time, apply the whitening formula to the teeth. After the final cycle, wipe off the whitening formula from the surface of the teeth. Remove the rubber dam and the cotton rolls. Remove the cheek retractor and protection wearing. And ask the patient rinse well. Reassess the new tooth shade of the shade guide and record the results. Showing the patient the changing of the tooth color and take another picture. After the procedure, give the patient post-treatment guide. Make sure the patient understands the guideline. Suggest to use the professional whitening toothpaste to maintain the whitening effect. In 24 hours after the treatment, avoid red wine, color, coffee, tea, sauces, and very hot or cold foods. Avoid tobacco products, colored toothpaste, and mouthwash. Recommend patient to consume non-colored foods. For patients with serious stains such as teeth discolored by medicine tetracycline or speckled by fluoride, we strongly suggest to a course of treatment 1 to 3 times treatment to achieve ideal whitening effect. Firstly, it is very important to communicate with the patient. The dentist should learn well the patient's desire for the whitening effect, and it is necessary to explain all the possibility in whitening treatment. It's easier to have sensitivity for teeth colored by tetracycline or fluoride. Usually such a sensitivity will disappear naturally within 24 hours. Teeth discolored by tetracycline or fluoride are specially discoloration by medicine, so more than one-time treatment is needed. Suggest to use home whitening products after the treatment to maintain whitening effect. Suggest whitening teeth first, then accept dental porcelain or others cosmetic dental treatment. Cold light teeth whitening would not influence the color of the rising corona, no side effect. Welcome to visit our web www.huaer.com to learn more about our company and products. Thanks for watching. Huaer will provide you more service when you need.